Namaste Sharade Devi Veena Pustakadharini Vidyarambha Karishyami Prasanna Bhava Sarvada. A very good afternoon to one and all present here. Firstly, we thank Augustcon and Vaidya Nanal Foundation for giving Sri Dhootpapeshwar Limited an opportunity to present an evidence-based research studies on this prestigious platform. Here, I present to you our first classical clinical trial on Bruhatva Chintamani Ras, prepared from the text reference of Bharat Bhaishajya Ratnakar. Each tablet of SDL's Brihatva Chintamani Ras has Swarna Bhasma, which is of premium quality and Parad Marit, Rajat Bhasma, which is Parad Marit, Abhrag Bhasma, Praval Bhasma, Mauktik Bhasma, Loha Bhasma, and Rasa Sindur. I take this opportunity firstly to thank Upendra Dikshit sir to making my job a little bit easier, because I will also be speaking on Rasa Pradoshach Vyadi. Over here you can see that each of the ingredient that is highlighted, so whether it is Suvarna Bhasma or Rajat Bhasma, which is Jatharagni Deepak, Abhrag Bhasma, which is Deepan and Shita Virya, Pravar Bhasma is also a Deepan. So as we say, Pravar is Shita, but it is also a Deepan Dravya. So Dushita Rasa Dhatu is the main cause of Rudrog. And here the entire ingredient or properties of Dhootpapeshwar's Bruhatva Chintamani highlights onto the Deepan, that is the Rasa Dhatavagani Vardhan, that is being seen as the Karya. Along with that, the Utpatti of Hruday has been said for Shonit and Kapha. And for that reason, wherever we see Sruto Rodh or Sruto Rodhatmak Samprapti, Rasa Sindur is one of the ingredient that has been added either in Bruhatvat or in Vasant Kusumakar or even in Rasaraj and Yogendra Ras. So here we see some of the symptoms of Vataja Rudro. We can correlate Rudgati Vaishamya to arrhythmias or Rud Dravata to tachycardia or even palpitation. Rudgati Mandya can be correlated to bradycardia. Rudkampa, Lupta Spandan, that is missing beat. And these are all few of the indications where Brihatva Chintamani Ras stands an important drug for use. In Pittaja Rudrog, so where we see the symptoms of Ruday Mausapak or correlated with myocarditis, Hruday Avaran Pak, that is pericarditis. So the ingredients like Praval Bhasma or Mauktik Bhasma or even Rajata Bhasma present in Brihatva Chintamani helps to reduce down the Pittaj Rudrok symptoms, or the Pitta Samprapti over here is being Bhanga. This is just a competitor's data analysis wherein the evidence base we have tried to see to it that other market competitors of Dhootpapeshwar, of Brihatva Chintamani that are available, we have tried to highlight the quantity of gold present in each of the constituent. Here we would like to say that Dhootpapeshwar is the pharmacy where we have the proficiency certificate that guarantees onto the results or authentication of our results that we have tried to publish over here. Now we move on to our clinical research trial, that is the cardioprotective effect of hormomineral formulation of Bruhatva Chintamani that was carried on in male Sprolly rats. So this is our, I would say, abstract that determines on our research product. So here we have tried to make 4 different groups of research modality. One was the normal control, the second was disease control, the third was in Brihatva Chintamani low dose, that is 14.3 milligrams or 14.13 milligrams per kg body weight. That is one tablet of Brihatva Chintamani corresponding to human dose. And the fourth group of category of mice that was selected was for Brihatva Chintamani high dose, that is 2 tablets per day for human dose. The parameters that were assessed was electrocardiogram. So pre and post ECG of the mice were also carried out. Along with that, the hemodynamic studies, that is left ventricular and diastolic pressure. Along with that, rate of ventricular contractility, systolic, diastolic and mean pressures were also analyzed. Cardiac biomarkers, that is CPK, MB, LDH, these levels were analyzed, and cardiac hypertrophy on dissection of the mice were analyzed. So these are the four control groups that were considered for this Brihatva Chintamani trial. Now here you can see that after giving Brihatva Chintamani, the model was very simple. On the first group, we had given just carboxymethyl cellulose for entire 30 days period. In the second group, we had given carboxymethyl cellulose along with isoproterenol. It is a drug which induces myocardial infarction. So on the 28th and 29th day, the bolus dose of isoproterenol was given to the disease control group. In the third and the fourth group, from the first day onwards, Brihatva Chintamani extract in low dose and high dose was given to the mice. And along with that, on 28th and 29th day, the mice were injected with isoproterenol to induce myocardial infarction. Prior to that, all their hemodynamic studies and parameters of blood were analyzed along with ECG. So these were the results that were seen after the 28th and 29th day of isoproterenol that was injected into the mice. So firstly, in the mice or the disease control group, there were drastic changes in the ECG with regards to their PR interval, ST segment. But in the control group, I would say with Brihatva Chintamani high dose, the changes were seen to be minimal. Treatment with Brihatva Chintamani high dose, there was significant improvement in systolic, diastolic as well as mean blood pressures. Brihatva Chintamani even significantly reduced the biomarkers, that is CPK-MB levels also. Along with that, LDH levels as well as SIRT1 receptors were also being seen activated in mice which were given high dose of Brihatva Chintamani. Minimal changes were observed in low dose of Brihatva Chintamani Ras. Along with that, the cardiomyopathy or I would say hypertrophy was also seen less in Brihatva Chintamani high dose mice. So this was the study that is on Mason staining, that the collagen that was deposited in disease control group was found to be higher, means the heart muscles were damaged to a maximum extent in mice who were not given Brihatva Chintamani and only on isoproterenol, whereas the mice where Brihatva Chintamani was used as per earlier, the collagen deposition was found to be less. It means that when Brihatva Chintamani is given in patients of cardiac disorders, it helps to improve the cardiac functionality. As per Ayurveda, it will help to improve your Rasa Dhatavagni. So Rasa Pradoshaj Vyadhi, as mentioned for by Sushrut Samhita for I would say cardiac disorders, Brihatva Chintamani Ras is very effective as a cardioprotective agent. This is one of the study that was carried out by SDM College Hassan, MD scholar, on Brihatva Chintamani Ras and neuroprotective activity. So here we have just highlighted a QR code. If you scan this QR code, the entire presentation in downloadable PDF format is available to you. So it definitely helps as a neuroprotective function of Brihatva Chintamani Ras. These are a few Amik prayogs that you can use Brihatva Chintamani Ras in different dimensions. So in case of hypertension, you can use Brihatva Chintamani with Prabhakar Vati. In Rudgati Vikruti, you can use with Lakshmi Vilas Ras Nardiya. In case of Ruddravata, to give as a Mausapeshi Balya, we promote Brihatva Chintamani along with Arjuna Rishta. In Pakshaghat, as it is a Vata Vikruti, as a Vata Nadi Balya, we promote this with Ekangavi Ras. In Jirna Vat Vikar with Vat Vidvams Plain or Maha, which is Jaipal Yukta. And in Smruti Nash, you can use it with Smruti Sagar Ras. Moving ahead, we have the second presentation that gives an idea with regards to evidence-based study of Amla Pitta Mishran. So Amla Pitta is also can be said as a Rasa Pradoshaj or Amashayagat Vyadhi. And in that we have one of our patent formulation called as Amla Pitta Mishran, wherein we have conducted an evidence-based study. So Amla Pitta Mishran of Sri Dhootpapeshwar Limited has been clinically tested as an evidence-based formulation in management of Amla Pitta. Now the question arises whether Amla Pitta Mishran is an anti-hypertensive, or sorry, anti-hyperacidity, just like what Gelusil is, or whether it is anti-secretory, like rabiprazole. So it was evidence that it has a dual effect. Hence, a better alternative in the management of symptomatic and evidence-based Amla Pitta. So, to concise the causes of Amla Pitta as mentioned in Madhav Nidan, the Amla and the Drava Gun of Pitta vitiation is considered as the major cause. As per Panchamahabhut Sangatan, Amla Pitta or Amla Ras is Agni and Prithvi Mahabhut Pradhan, and Drava Guna is Jala Mahabhut Pradhan. The ingredients of Amla Pitta Mishran are Tikta Rasatmak, which helps in the management of Amla Pitta. Now here we can see the symptoms of Amla Pitta. In concise way we can say Amla Guna Drava Yuktam Pittam Amla Pittam. So Amla and Drava are the two gunas of Pitta that have been vitiated, causing this Amla Pitta. And in today's world we can correlate it with Hari, Vari and Kari. Moving ahead, the symptoms that are seen in patients of Amla Pitta. Now here we have tried to bifurcate Amla Pitta symptomatically and evidence based. So symptomatically, when we have a patient coming to our clinic who says that I have Rullas, or I have Udar Gaurav, or I have Avipak, Shirashul. So these are the symptomatic patients that we see. But evidence based patients are being seen in endoscopically done for this Amla Pitta revision. So patients with Amla Pitta present with Avipak, Klama, Utklesha, Tikta, Amlodgar, Guruta and Ritkanta Daha. So our main treatment objective in treatment of Amla Pitta first remains address the cause. One of the symptom that a patient might be telling you of Amla Pitta is Parshani Shula, which is one of the Upadrava of Amla Pitta. So if you have any patient who comes with heel pain, please consider that it may be one of the symptom of Amla Pitta and we need to rule that out. So first treatment objective is address the cause, reduce the acid secretion. So like what we say that first is to see that the acid secretion is reduced for proper healing if there is any ulcer or if there is any kind of ulcer, I would say the mucosal damage. Mucosal barrier protection, that is cytoprotective action, and improving the gastrointestinal motility and reassurance to the patient. Amla Pitta Mishran is basically Pachan, Tikta Bahal and Pathya. So if we say, or in a concise way, if I want to say, Amla Pitta Mishran is not a single medicine, but it is an entire prescription. It has Sauktik Bhasma. So for that we say that every time when you use Amla Pitta Mishran, shake well before use. Otherwise there might be some sedimentation. So that can be, I would say, compared to calcium channel blocker kind of an action. It is Madhur Rasatmak also. The entire other drugs of Amla Pitta, including Bhu Nimba, Nimba, Guduchi, Parpata, Bhrungaraj, are Tikta Rasatmak Dravyas. So which helps in the vitiation of Pitta management. And along with that, we have Yashti Madhu. Yashti Madhu can be correlated to a natural steroid. Along with that, it has a cytoprotective action, means it helps in the mucosal barrier. Now in 2002, when we started with the first study of Amla Pitta Mishran, at that time we have completed only onto the rats that this Amla Pitta Mishran was being tested for its anti-ulcer activity. So this is the evidence-based study that was conducted on rats. And now in 2020, we have graduated to conduct and complete our study on human beings also. This study is CTRI registered, and along with an eminent gastroenterologist, Dr. Manoj Lahote of Chhattisgarh, we have conducted this entire evidence-based study of Amla Pitta. Now, this study was conducted only on antral gastritis. Reason is that the antrum is the lower part of the stomach, which is most commonly affected in case of hyperacidity. And in this, you can see from severe antral gastritis to even mild antral gastritis, we have seen improvement within a month of treatment, where 15 milligrams of 15 ml of Amla Pitta Mishran was administered twice in a day to the patient. So one is prior to the administration of the medicine, and the next is 1 month after taking of the treatment, that these endoscopic studies have been conducted. These studies were conducted on 30 patients, out of which 28 patients had completed the study, 2 patients had dropped out. So we have mentioned over here the CTRI number and everything for anybody for future reference. These were the symptoms that were looked on for symptomatic relief in the patient. So first we had seen the evidence-based study, and now this is the symptomatic patients, which we call it as functional dyspepsia, wherein the endoscopy is normal but the patient having the symptoms. So in these cases also, Amla Pitta symptom rating scale was done with regards to the symptoms like Tikta Amlodgar, Rutkantadaha, Aruchi, Guruta, Utklesha. And within 15 days of the first medicine starting, that we can see visit 3, we had seen significant improvement in the patient. And after 1 month of completion of the dose, the patients symptomatically as well as evidence proof also, they were having much better relief. So to conclude, at last I would like to mention how effective is Amla Pitta Mishran. So it is effective and safely reduces endoscopic gastritis. So evidently also we have seen that Amla Pitta Mishran helps to reduce down the gastritis. It is not only acting on the offensive mechanism, that is to control the acid secretion and neutralize the acid, but also the defensive mechanism, that is the cytoprotective activity, which is evident from the use of Yashti Madhu in our Amla Pitta Mishran. Symptomatic reducement, I would say, along with that, in cases of migraine, safe to be used even in cases of pregnancy. So this is our evidence-based study on Brihatva Chintamani Ras and Amla Pitta Mishran. And once again, I thank Nanal Foundation for giving Sri Dhootpapeshwar Limited an opportunity to present this evidence-based study. Thank you so much.